pancreas, it has only two hormones, and the neurohypophysis is an uh, reservoir of these hormones. They are secreted by hypothalamus. Those two hormones you already know about. One is oxytocin, another is ADH, antidiuretic hormone, or we also call it as vasopressin. So ADH is antidiuretic hormone or vasopressin. Okay, so the vasopressin I've already told you in the kidneys, they help in the reabsorption of water. So whenever uh, there is deficiency of ADH, large amount of water is lost through urination. It is dilute urination. So the water is not reabsorbed and it is lost whenever there is hyposecretion, that is low secretion of ADH. So you should remember about that. So it causes a disease called as diabetes mellitus is because of deficiency of insulin. Diabetes insipidus, we call it as. It is deficiency of ADH which causes diabetes insipidus. So you have to remember about this diabetes insipidus and the deficiency of diabetes insipidus, how it affects us. Okay. The diabetes insipidus, it leads to dilute urination. Huge amount of water is lost through the urination process, and here it is mainly because of deficiency of antidiuretic hormone or vasopressin. See, the diabetes mellitus, it is due to deficiency of insulin hormone. So as a result of it, the urine is concentrated. So the glucose is lost even through the urine. That is the reason the wherever there is a diabetes checkup, so they take the blood sample before fasting and after fasting. So the urine sample is taken before fasting. Okay, so that's the reason that they take the urine sample also to analyze the amount of glucose present in the urine. So you should understand about this diabetes insipidus and difference between diabetes insipidus and diabetes mellitus. So whenever I'm talking about ADH deficiency, so it causes diabetes insipidus, dilute urination, excess loss of water during the urination process. That is because of deficiency of antidiuretic hormone. Okay, so these we had discussed in the previous class. Then I had also told you about the secretions of the anterior part of pituitary gland, or adenohypophysis we also call it as. So where I had discussed about the somatotropic hormone or growth hormone. So I have even shown you the gigantism, dwarfism. Okay, those examples we had discussed in the previous class. Okay. Then there is also the thyroid stimulating hormone deficiency, of which it causes many diseases. Then luteinizing hormone. So all this we had discussed in the previous class. Okay. So now, uh, 1 minute, students. Okay. So now today's class we are going to discuss about the parathyroid gland. Okay. So these are. Let me just zoom it up. See the parathyroid gland, these are four glands. Can you see this? Yellowish, orangish yellow colored one. These are the four glands present on the backside of the thyroid gland. One pair each in the two lobes of the thyroid gland. You know that this thyroid gland are held together by isthmus. So we had discussed that in the previous class. So the parathyroid glands, they are four glands. These are four glands present on the backside of the, as the name indicates, parathyroid. So it is present at the backside of the thyroid gland. So these four glands, each lobe has two glands of this. So they secrete parathyroid hormone, PTH, which is a peptide hormone. Peptide means proteinaceous in nature, isn't it? So it is they secrete a parathyroid hormone, which is a peptide hormone. What are the functions of PTH or parathyroid hormone? They help in the maintenance of calcium homeostasis, that is balance in the amount of calcium so within our body that is brought about by this parathyroid hormone. So whenever there is increased amount of calcium ion level in blood, that is increases calcium ion level in blood, so hypercalcemic hormone, so stimulates the bones reabsorption or demineralization of bones. So that is also brought about by the parathyroid hormone. So the parathyroid hormone also stimulates the reabsorption of calcium ion by renal tubules and increases calcium ion absorption from the digested food. Along with the TCT, it helps in calcium balance in the body. Okay, so along with that, what we call it as TCT. So we had studied it in the previous class when we had discussed about thyrocalcitonin. TCT is thyrocalcitonin. So it's a protein hormone. It regulates the blood calcium level we had discussed in coordination with this TCT or thyrocalcitonin. So the parathyroid hormone, so they also are going to, along with TCT, thyrocalcitonin, so parathyroid hormone or PTH, it helps in calcium balance in the body. So homeostasis is maintenance of constant level of calcium within our body. So that is majorly done by uh, the TCT, thyrocalcitonin, as well as the P para PT H, that is the parathyroid hormone. So, what is the role of the parathyroid hormone? It is going to increase the calcium ion level in blood. We call it as hypercalcemic hormone. So, the hypocalcemic hormone is the TCT, thyrocalcitonin. Hyper is the hypercalcemic hormone. You can also call it as parathyroid hormone. It stimulates the bone reabsorption, that is demineralization. It also stimulates the reabsorption of calcium ion in the kidney and by renal tubules in the kidney, and increases calcium ion absorption from food. Okay, along with TCT, it helps in calcium balance in the body. So that is the major role of the parathyroid hormone. See, calcitonin, they are going to decrease the amount of calcium, whereas the parathyroid hormone, so they are releasing it, they increase the calcium uptake in kidneys from bones, reabsorption of calcium ions from bones, that is demineralization. So reabsorption of calcium ions from renal tubules and increase calcium ion absorption from the digested food. So along with this, thyrocalcitonin, so parathyroid hormone, it helps in calcium balance in the body. So the major role of this calcitonin is it stimulates the calcium deposition in bones, reduces calcium uptake in kidneys. That is whenever there is low amount of calcium. So the major things that are happening. Okay, so it is going to reduce the uh, calcium ion level, whereas the parathyroid hormone, it is going to increase the calcium ion level. Okay, that is about PTH, parathyroid hormone of it. Now, thymus gland. So the thymus gland, it is a bilobed gland. So they have two lobes. You can see this located between lungs, and it is behind sternum on the ventral side of the aorta. So it is behind the sternum. Sternum is behind that you find this, and it is located on the ventral side of the aorta. So it increases it. What does this thymus gland does? It secretes thymosins. Again, they are peptide hormones, so proteinaceous in nature. So they secrete the thymosins. So the thymus gland, it is a bilobed gland. So it is a bilobed gland, you can see here. So this thymus gland located between lungs. So in between the lungs, you can notice this thymus gland located between the lungs behind the sternum on the ventral side of aorta. So you can notice this on the ventral side of the aorta. So it secretes thymosin, that is peptide hormone. That is the location of thymus gland, which is bilobed. It is located in between the lungs and behind the sternum on the ventral side of the aorta. It secretes thymosins or peptide hormones. What are the functions of this thymosins? So they help in differentiation of T lymphocytes, which provide cell mediated immunity. So promote antibody production for humoral immunity. So the major functions of this thymosins are they are going to differentiation of T lymphocytes which are uh, undergoing maturation in the thymus gland. So the differentiation of T lymphocytes, which produces cell-mediated immunity, and it also promotes. So the thymosins they also promote antibody production for humoral immunity. So thymus, it gets degenerated in old individuals. So the production of thymosins decreases. See, in newborn, the thymus is well developed. As they are aging up, the thymus glands are going to degenerate in older individuals. So the production of thymosins decreases as a result. So the immune response of old persons become weak. So the immunity level of age people, they are going to become weak. So that is what we have to remember about. See, when we come to the second year, now it would be too early. We'll be discussing about the types of immunity. Okay, the structure of antibody and other things we'll be discussing in the 12th standard. As of now, you remember cell mediated immunity, that is cell initiated immunity. They provide our protection to our body from this antigens. Okay, as of now, you don't concentrate too much on that. In the next academic year, 12th standard, we'll be discussing about antibodies, structure of antibody, and the types of immunity. Then we'll be discussing about it. Okay. So as of now, you just remember active immunity, passive immunity. There are varieties. We'll be discussing that only in the 12th standard. So remember the name cell mediated, as the name indicates, it is mediated by the cell. So cell mediated immunity. Okay. So let us proceed with this discussion of this thymus gland as I was talking about. So thymus is degenerated in older individuals. So the production of thymosins or the hormone, it decreases. As a result, in aged people, the immune response of old people, they become weak. So you can see in a newborn, the thymus gland is very active. So as they are aging up 10 years, it gets reduced. In 25 years, the thymus gland gets much more reduced. In 50 years old individual, the thymus gland is much more reduced. Okay. And in a 70-year-old uh, person, so the thymus gland is uh, very much degenerated. So the production of thymosins is very less in case of 70-year-old person. So as per this comparisons, as a result, immune response of old people, it becomes very weak. So the next that we are going to, that is about thymosins, the functions of thymosins, cell mediated immunity. So they bring about differentiation of T lymphocytes, which provide cell mediated immunity. So the thymosins also promote antibody production for humoral immunity. Types of immunity, we'll be discussing it in the 12th standard. I had already told you about that. So just remember the names for this year. So the adrenal gland. So the adrenal gland, it is, as the name indicates, adrenal gland. So above the kidneys. So you can find this adrenal gland above the kidneys. You also notice the fat bodies. So the adrenal gland, it has two parts. So the adrenal cortex, which is the outer part, and the adrenal medulla, which is the inner part. So the adrenal gland has two parts, the adrenal cortex, which is the outer part, and the adrenal medulla, which is the inner part of it. So remember these two zones within the adrenal gland. So adrenal cortex, what are its layers? So they have three layers. So the adrenal cortex, it has three layers. So zona glomerulosa, zona fasciculata, zona reticularis. So you can remember it as GFR. So zona glomerulosa, zona fasciculata, zona reticularis. So GFR, you can remember it as. Okay. So uh, that is the mnemonics that you can use to remember this. So the adrenal cortex has three zones: zona glomerulosa, zona fasciculata, zona reticularis. R stands for reticularis. So GFR, zona glomerulosa, zona fasciculata, zona reticularis. So that is how you remember the three zones. The outermost zone is glomerulosa, inner middle layer is the fasciculata, middle zone, and the inner zone is zona reticularis. So these are the three layers of adrenal cortex. So the adrenal cortex, it produces corticoid hormones such as, so the corticoid hormones that are produced by the adrenal cortex are glucocorticoids, mainly cortisol hormone is it is synthesized. Mineralocorticoids, mainly aldosterone. See, the antidiuretic hormone and aldosterone, they help in reabsorption of water. So both of them are going to help in that. So the uh, mineralocorticoid hormone, you can remember aldosterone. So the glucocorticoid hormone, you can remember cortisol. Androgenic corticoids. So these are the type of corticoid hormones. So glucocorticoids, you can remember the cortisol. Then the mineralocorticoids, mainly aldosterone, you can remember. And then the androgenic corticoids. So the glucocorticoids, what are they involved in? See, the glucocorticoids, they are involved in carbohydrate metabolism. Okay, they stimulate gluconeogenesis. Glucose, neo means new, genesis means formation. So new glucose formation is stimulated by the glucocorticoids. Okay, lipolysis. Lipo means lipids, lysis means breakdown. So breakdown of lipids. And proteolysis. So that is breakdown of proteins. So they are glucocorticoids. They are majorly involved in the carbohydrate metabolism. So they stimulate gluconeogenesis, lipolysis, and proteolysis. Remember, lysis means breakdown. So the glucocorticoids, they are also going to inhibit means prevent the cellular uptake and utilization of amino acids. So they are going to prevent the cellular uptake and utilization of amino acids. So glucocorticoids, they prevent the utilization, uptake and utilization of amino acids. Okay. So maintain cardiovascular system and kidney functions. So the glucocorticoids majorly play a role in maintaining the cardiovascular system, that is the heart and vascular system and kidney functions. So they are going to be maintained by this glucocorticoids. Cortisol, one of the variety of glucocorticoid, they stimulate RBC production. Okay, so the RBC production is stimulated by this cortisol, one of the glucocorticoid hormones. So you have to remember this. All these might be asked for your um, NEET or your CET examination. See, the glucocorticoid, they are going to stimulate dash gluconeogenesis, lipolysis, proteolysis, all of these. So what would be the answer here? So it would be all of these. So the glucocorticoids, they are going to stimulate gluconeogenesis, lipolysis, that is breakdown of lipids, and proteolysis, breakdown of protein. So they are also going to inhibit cellular uptake and utilization of amino acids. That is also one of the important functions of this glucocorticoids. They are going to prevent the uptake of This cellular uptake and utilization of amino acids is prevented by this glucocorticoids. They maintain cardiovascular system and kidney functions. So the cortisol also stimulates the production of RBC. They produce anti-inflammatory reaction and they suppress immune response. So glucocorticoids, they're also going to produce anti-inflammatory reactions and suppress immune response. So you can notice here how the amino acids and other things. So protein degradation, protein synthesis, glucose utilization, sensitivity to insulin. Okay, so the lipolysis is also noticed in case of this glucocorticoids. The adrenal cortex, we also call it as mineralocorticoids, especially aldosterone. You have to remember under this. So the adrenal cortex regulate the water body fluid volume. So you can see the a girl having water. So we as terrestrial animals, we are exposed to very little amount of water, and as terrestrial animals, our body should be able to conserve water. So this antidiuretic hormone, the aldosterone, they play a very important role in conservation of water. So the mineralocorticoids, they regulate the water, that is body fluid volume, electrolytic balance, osmotic pressure, and blood pressure. So that is the major role of mineralocorticoids like aldosterone. So they regulate the water. Okay, that is the first function of it. So electrolytic balance, they are going to regulate, then regulate the osmotic pressure, and they are also going to regulate the blood pressure. So aldosterone plays, the mineralocorticoid plays a very important role. And this aldosterone, they stimulate the reabsorption of sodium ion and water from renal tubules, and they promote the excretion of potassium ion and phosphate ions. So aldosterone stimulates the reabsorption of sodium ion and water from renal tubules, and they are also going to excrete potassium ion and phosphate ions. So that is a major role of aldosterone. Aldosterone, along with antidiuretic hormone, they play an important role in reabsorption of water. So the reabsorption of sodium ion is also brought about by aldosterone. So aldosterone promotes the secretion of phosphate ions and potassium ions. So the adrenal cortex, the third part of it is the androgenic corticoids for growth of axial hair, pubic hairs, and facial hair during puberty. The major role is by this androgenic corticoids. They play an important role in the secondary sexual characteristics. So wherein there is a growth of axial hair, the pubic hair, and the facial hairs. Okay, so all these are the secondary sexual characteristics that you notice because of this androgenic corticoids during puberty. So most of you would be going through this process of adolescence at presence. Okay, the bodily changes, most of the changes that takes place where you are having a transition from child to an adult. So this transition process, the aldosterone hormone plays an important role apart from the other hormones like testosterone in case of male, and in case of female the estrogen, so which plays an important role in the primary and secondary sexual characteristics. So more details on that you'll be studying it in the 12th standard, the first topic. So the reproductive system will be discussing about that. As of now, remember that in adrenal cortex, so the third variety of hormone from the adrenal cortex is this androgenic corticoids. So this androgenic corticoids, they are responsible for growth of axial hair, the pubic hair, as well as facial hairs during puberty. Especially in men, the facial hairs are more. So this androgenic corticoids, they play an important role in this growth of axial hair, pubic hairs, and facial hair during puberty. Pubic hair is especially found uh, around the genital organs. Okay. Now, what is the deficiency of this corticoid hormones leads into? It affects the carbohydrate metabolism. It causes acute weakness and fatigue. So this condition is called Addison's disease. So the deficiency of corticoid hormone, they affect the carbohydrate metabolism. So you know that the carbohydrate metabolism wherein so there is going to be gluconeogenesis, lipolysis, proteolysis, it takes place. Okay, that carbohydrate metabolism will be affected, as well as the glucocorticoids. You know about how they prevent this amino acids being transferred. So that is also one of the important role of this adrenal glucocorticoids of adrenal cortex. So whenever there is a deficiency of corticoid hormones, it results, it affects the carbohydrate metabolism, and it causes acute weakness and fatigue. So they become very tired. This condition is called Addison's disease. So you can see the hands of people who are affected by this Addison's disease and a normal hand. So the difference you can notice here. The next is adrenal cortex. We have studied about the outer part of the adrenal gland. The inner part of the adrenal gland is adrenal medulla. So they are going to produce catecholamine hormones. So the catecholamine hormones. So you can also remember it as catecholamine hormones. So they are going to be produced by this adrenal medulla, such as adrenaline or epinephrine and noradrenaline or norepinephrine. So the adrenaline, many times you might have been used, my adrenaline is pumped up. That is, whenever you're ready for any action, you just say that my adrenaline is pumped up, isn't it? So literally we use such words. So this adrenaline hormone is also called as 3F hormone or emergency hormone. So it is of survival value in all the animals, including human beings. So the adrenal hormone, what are the three things that are found in the adrenal hormone? Three F's, I called it as fight, flight, and fear hormone. So the 3F hormone or emergency hormone or adrenaline is secreted by the adrenal medulla. So they are also called as catecholamine hormones, one of the variety of catecholamine hormones. Adrenaline is the emergency hormone or 3F hormone. What is this 3F? Fight, flight, or fear. See, whenever you are faced with danger, okay, so you are either rooted to the ground out of fear, you do not do anything, you do not know what to do. So you are rooted to the ground out of fear. Or second aspect is, if you find that the source of discomfort is a person who's someone is coming and threatening you, and that person is smaller than you, then what will you do? You are ready for fight. Okay, but if you have a person like rock or someone coming and standing in front of you and threatening you, so you feel intimidated, isn't it? You feel like you can't face the challenge. So the best thing that you do is run away from that place. Okay, so the fight, flight, so fight, flight is running away from that place, and fear hormone. So the 3F hormone is the adrenaline hormone, or we also call it as epinephrine hormone. So what are the changes that takes place whenever the adrenaline hormone is there? So we undergo bodily changes like the dilation of the pupils, then we are ready for a fight, and the increased rate of heartbeat. So all these are increased blood pressure. So all these are going to be a mode for fight, flight, or fear. So sometimes out of fear, we are rooted to ground. We do not know what to do. Okay, so this 3F hormones, the fight, flight, and fear, is because of this adrenaline, and they are of survival value. Okay, so just remember, we did not have this hormone. Early man who had to fight against the predators like tigers, lion, and others, if he did not have this hormone, so he would have become an easy food for these predators, isn't it? You would have become easy victim for these predators, because without this emergency hormone, his body might not be prepared for fight, flight, or fear. Okay, so they are of survival value. Remember about this adrenaline hormones. So they are catecholamine hormones. Two of them are there: adrenaline hormone, or we call it as epinephrine hormone, or 3F hormone, or emergency hormones, and noradrenaline, we call it as norepinephrine hormone. So the exact opposite function of adrenaline is done by norepinephrine. After this emergency state, we can't remain in this emergency condition of our body throughout our lifetime. It has to come back to normal. So the heartbeat has to get reduced, the breathing rate has to get reduced, so the pupils should get normal, constriction should be there. So those are all happening because of this noradrenaline hormone or norepinephrine hormone. So they are also having a role with the sympathetic nervous system and parasympathetic nervous system. So they are involved together. Okay. So the catecholamine hormones, they are rapidly secreted in response to stress, emergency situations. So this are also called as emergency hormones, or hormones of fight or flight. So they are rapidly, the catecholamine hormones, they are rapidly secreted in response to stress, emergency situations. So they are called as emergency hormones, or hormones of fight, or hormones of flight, where you run away from the place. Okay. So these hormones from the adrenal medulla, they increase alertness. The pupil within the eye, I'm talking about pupillary dilation, piloerection, that is a rising of hairs, sweating, heartbeat, heart contraction, and respiratory rate. Increases the respiratory rate, sweating takes place, heartbeat increases, the contraction of heart takes place. So these are all going to take place by the activity of adrenaline. So wherein there is the body is prepared for an emergency, for fight. So they also stimulate adrenal medulla. They also stimulate breakdown of glycogen. So the glycogen breakdowns to release glucose in blood. Okay, that is the, whenever there is more glucose in blood, so there can be more energy by the breakdown of glucose. They also stimulate the breakdown of lipid and proteins. So this emergency hormones, they also are going to stimulate breakdown of glycogen to increase glucose in blood. They also stimulate the breakdown of lipids and proteins. The next that we will be discussing about is pancreas. So pancreas is an heterocrine gland. I have already discussed this in detail with you all, wherein it is both exocrine and endocrine gland. Okay, that is why we also call pancreas as heterocrine gland, because it functions both as an exocrine and endocrine gland. Exocrine gland, they secrete the enzymes through this pancreatic duct, which are released into the duodenum. Okay, and the endocrine part is they have islets of Langerhans. So they are small group of islands. So they have three types of cells: islets of Langerhans, alpha cell, beta cell, delta cell. So alpha, so there are about 1 to 2 million islets of Langerhans. Okay, so 1 to 2% of pancreatic tissue is made up of this islets of Langerhans. So there are 1 to 2 million islets, which is nothing but 1 to 2% of pancreatic tissue is having this islets. Okay, so alpha cells and beta cells in these islets, they secrete peptide hormones such as, say, alpha cells secrete glucagon, beta cells secrete insulin, respectively. So the alpha cells secrete glucagon, beta cells secretes insulin respectively. They maintain glucose homeostasis in blood. See, whenever the glucose level increases in blood, so the insulin is released, and this insulin converts this excess of glucose in blood into glycogen. Okay, even after that, there is excess of glucose in blood, it is converted into lipids. So lipogenesis takes place. Okay, so the fats being deposited around the belly area, it is majorly because of this more than required amount of glucose being present in our body. So that is done by this insulin. So they are going to uh, reduce the amount of glucose to normal level, so insulin. So the glucagon hormone, so they are this happens whenever there is less amount of glucose. The glucagon hormone, they are going to break down glycogen stored in liver and muscles and release glucose. There is, even after that there is no energy, then they break down the lipids, proteins. So lipolysis, proteolysis, they take place majorly because of these glucagon hormone. So they help in maintaining this homeostasis. A constant level of sugar is maintained in the blood. So that is because of these two hormones, insulin and glucagon. So they maintain glucose homeostasis in blood. So glucagon is an hyperglycemic factor. So whenever there is uh, a less amount of glucose, so they are going to secrete uh, the glucose. So functions, it acts on hepatocytes, that is liver cells, and stimulates glucogenolysis, that is breakdown of glycogen. Glycogen is stored in the muscles and liver, you know that. So glycogenolysis, breakdown of glycogen. Okay, and they increase the blood sugar. That is why glucagon is also called as hyperglycemic factor. So they stimulate gluconeogenesis. They also stimulate gluconeogenesis. So that is a synthesis of glucose from new synthesis of glucose. So they reduce the cellular glucose uptake and utilization. So that is the role of glucagon or hyperglycemic factor secreted by alpha cells. Insulin is hypoglycemic factor. So they reduce the glucose level in the blood. That is why we also call insulin as hypoglycemic factor. So the insulin, they act on hepatocytes and adipocytes and enhances cellular glucose uptake and utilization. So blood glucose rapidly moves to hepatocytes and adipocytes. Thus blood glucose level decreases. So we call it as hypoglycemia. So insulin is going to reduce the blood glucose level. So we call it as hypoglycemic factors. So insulin also stimulates the glycogenesis, that is synthesis of glycogen. So the glycogenesis or glycogenesis, that is glucose is converted to glycogen. Around 100 grams of it is stored in liver, 400 grams of glycogen are stored in muscles. So that is done by this insulin. So insulin is going to reduce the glucose level in the blood. So that is the reason insulin is also called as hypoglycemic factor. The secretions of pancreas, especially from islets of Langerhans, so they are going to bring about regulation of blood glucose. Okay, so you should understand on this aspect of it. So the next part is the pancreas. So the diabetes mellitus. So the whenever there is a deficiency in secretion of insulin, so it causes this diabetes mellitus. Mellita means honey. Okay, so diabetes mellitus. So the urine is also going to have glucose being secreted. Generally, a person who is affected with diabetes mellitus, if he urinates in an open space, so the later you might notice that the urine will be encircled by the ants. The reason is the urine has glucose in it. Okay, so the diabetes mellitus, it is because of deficiency of insulin hormone. So it is the disorder due to prolonged hyperglycemia. Prolonged hyperglycemia is prolonged presence of this glucose in blood. Okay, symptoms of this diabetes mellitus are loss of glucose through urine and formation of harmful compounds like ketone bodies. Okay, so loss of glucose through urine and formation of harmful compounds like ketone bodies. So treatment is for diabetes mellitus, the treatment is insulin therapy. Okay, so glycosuria, then you can also remember about the polyphagia, polydipsia, excessive thirst, excessive frequent urination. Okay, so polyphagia, polyuria, and uh, excessive consumption of food. So all these three are the symptoms of glucose. Okay, frequent urination, excess consumption of water, excess consumption of food. So they are all the symptoms of diabetes mellitus. So polyphagia, polydipsia, polyuria. So all these are the symptoms of diabetes mellitus. Now let us discuss about this gonads or the reproductive organs. So the gonads are of two types. Here we don't use the term antheridium archegonium, or we don't use the term andrecium gynoecium. So in animals we use the term testis is a male gonad or reproductive organ which produces the sperms. Ovary is the female gonad which produces the egg cell. So the gonads are of two types. So the testis, male gonad, and the ovary, which is the female gonad. So within the scrotum, the testis is found, a pair of testes is there, which produces the sperm cells. So within the abdomen, you can notice the ovary. The ovary is going to produce the egg cell or ovum. So the gonads are of two types: testis, male gonad; ovary is female gonad. So let us discuss about this gonads. Testis, it is the male primary uh, sex organ and an endocrine gland. So it is also an endocrine gland, testis, you have to remember about. So a pair of testes is present in the scrotal sac. Okay, so testis is the male primary sex organ and an endocrine gland because they also secrete testosterone. So a pair of testes is present in the scrotal sac. So what is the testis formed of? So the testes are formed of seminiferous tubules and interstitial stromal tissues. So they have seminiferal tubules and interstitial tissues or stromal tissues, we also call it as the Leydig cells in the intertubular spaces. So the Leydig cells, which is there in tubular spaces, they are going to produce hormones called as androgens, the male hormones or androgens, and mainly they are going to produce the testosterone. So testis, it is formed of seminiferous tubules and interstitial tissues, or we also call it as stromal tissues. So the Leydig cells or interstitial cells, we also call it as Leydig, name of the scientist. So the interstitial cells or Leydig cells in the intertubular spaces, they are going to produce so the androgens or male hormones. So mainly it is testosterones. Okay. Functions of androgen. So they regulate the development, maturation, and function of the accessory sex organs. That is, they are going to regulate, control the development, maturation. So the function of hormone, the testosterone, especially we are talking about the primary sexual characteristics like maturity of the testes and production of sperms. So they are also brought about by this testosterone. The secondary sexual characteristics like appearance of facial hair, so the voice breaking and the what you call it as the masculine voice. So that is all happening from uh, the puberty, after the puberty, and from adolescence to an adult. So the appearance of armpit hair is nothing but axillary hair. So the pubic hairs growing around the genital organs, plenty of body hairs and facial hairs. So they are all the functions of this androgen secreted by the testes, that is nothing but testosterone. So they regulate, these hormones regulate the development, maturation, and functioning of the accessory sex organs. Spermatogenesis, that is sperm production, is also induced by them. Stimulate sexual behavior, that is libido, growth of muscles, hairs, aggressiveness, low pitch voice. All these are because of this testosterone. Okay, so you have to remember that anatomically, psychologically, and emotionally, men and women differ in their approach. So that is why there is a book written, Men Are From Mars and Women Are From Venus. So that is like they are from two different planets. That is what they say. But anyway, these differences in men and women are because of this hormone, testosterone in case of male and estrogen in case of female. So the primary sexual characteristics and secondary sexual characteristics in case of male is because of this hormone, male hormone or androgen or testosterone. Okay, so the spermatogenesis, that is the sperm production, is produced by this uh, the uh, androgen or testosterone. They also stimulate, these hormones also stimulate the sexual behavior or libido, the growth of muscles, hairs, the facial hair, axillary hair, pubic hairs, aggressiveness. Men are more aggressive because of this testosterone, and low pitch voice. Okay, so the androgen also helps in anabolism of protein and carbohydrate. That is, they are going to help in the synthesis of protein and carbohydrate. So the development of muscles, okay, high energy level, all these are because of this testosterone, which promotes anabolism of protein and carbohydrate. So the next is the gonad, is the female gonad, that is ovary. So it is the female primary sex organ. So a pair of ovaries is located in the abdomen. Okay, a pair of ovaries is located in the abdomen. It produces one ovum or egg cell during each menstrual cycle. So during each menstrual cycle, it produces one ovum or egg cell. So that is the 28 days cycle. It's an average. It varies from one individual to another individual, and various factors are there. So, but uh, in most of the time, the menstrual cycle is of duration of 28 days. Okay, so it produces one ovum during each menstrual cycle. So the menstrual cycle, we study about that in detail in the uh, second year 12th standard. As I told you, the reproductive organs and reproductive system, when we come to, we'll be studying about that. So here you have to just remember about the hormone estrogen and its role. So estrogen plays an important role in the primary sexual characteristics of female, like they help in the maturation of ovary, the formation of ovum, that is the release of ovum. So that takes place during this menstrual cycle. So every 28 days, there is a menstrual cycle, so in which one ovum is released. If it is not fertilized, it is lost during the menstruation process. The unfertilized egg cell is discarded from the body. So it produces one ovum during each menstrual cycle. So that is the ovary. So ovary is formed of ovarian follicles. So primary follicles, secondary follicles, then the mature one, we call it as Graafian follicle. So the Graafian follicle releases this ovum or egg cell. See, ovary is formed of ovarian follicles and stromal tissues. So the ovarian follicles, they produce estrogen, which is a steroidal hormone. After ovulation, that is, from the Graafian follicle, there is release of ovum. So after ovulation, so the ruptured follicle which has released the ovum, so they are going to function as corpus luteum. Okay, it secretes progesterone, a steroidal hormone. So after ovulation, the ruptured follicle, they form a structure called as corpus luteum, which secretes progesterone, a steroidal hormone. So in case the egg doesn't get fertilized, so the corpus luteum also degenerates. If in case the egg gets fertilized, the corpus luteum becomes functional and they start secreting this progesterone, a steroidal hormone. So the functions of estrogen, similar to the testosterone, the primary and secondary sexual characteristics in case of females are because of this estrogen hormone or the female hormone, that is the estrogen, which is secreted by ovary. Ovary is a primary sex organ as well as the endocrine gland. So what are the secondary growth in case of women from puberty to adult? Okay, so they stimulate the growth and activities of female secondary sex organs like, okay, so they stimulate the growth and activity of female secondary sex organ like ovary. The maturation takes place, the menstrual cycle commences. Okay, so the first menstrual cycle we call it as menarche. The last menstrual cycle is called as menopause. Okay, so anyway, the ovary, it is going to the estrogen is going to stimulate the growth and development of this female secondary sex organ, that is the ovary. So the secondary sexual characteristics, that is appearance of axillary hair, pubic hairs, so they are all the secondary sexual characteristics, high pitch voice, and the sexual behavior uh, is because of this estrogen hormone. Then there is also development of mammary glands. Okay, so the hips broaden. So all this we are going to study in detail in the next academic year. I've told you about. But here the major thing that you have to remember is the hormones that are released by the ovary, estrogen, the female hormone, the typical characteristics of female, the secondary sexual characteristics of female is brought about by estrogen. Then the functions of progesterone. I told you already the mature graphene, mature follicle after releasing it, the ruptured follicle, they are going to function as corpus luteum and they become functional only when there is the fertilization of egg cell. So they are going to release progesterone. I told you about, which is a steroidal hormone. So progesterone supports pregnancy. See, oxytocin is also one of the pregnancy hormone. Progesterone is also one of the pregnancy hormone. So they are going to stimulate, it supports pregnancy. So the progesterone acts on the mammary glands to stimulate the formation of alveoli, sacs to store milk and milk secretion, especially the nursing mother should be producing the milk to feed the infant. Okay, so that is being done by the progesterone. So the progesterone supports pregnancy. It acts on mammary gland to stimulate the formation of alveoli, the sacs to store milk, and milk secretion. Okay, the structure of the uh, mammary gland in case of human beings, will be studying about that in detail in the next class, that is in the 12th standard. Okay, so there is a the alveoli sacs which stores the milk and milk secretion takes place through the milk duct. Okay, that is the role of the progesterone. Next, we'll go for the atrial wall of heart. So that is the auricular walls of the heart. They are going to secrete atrial natriuretic factor, ANF. So they are going to secrete the atrial wall of heart, the auricles of the heart. They are going to secrete a hormone which we call it as ANF, atrial natriuretic factor. So whenever the blood pressure increases, the ANF at atrial natriuretic factor, they causes the dilation of blood vessels to reduce the BP. So the atrial natriuretic factor, whenever the blood pressure increases, they cause the dilation of blood vessels so that they can reduce the BP or blood pressure. So this vasoconstriction, vasodilation. So the vasodilation is brought about by this uh, atrial wall of heart. It is brought about by the secretion of atrial wall of heart, that is ANF, atrial natriuretic factor. So they reduce the blood pressure by dilation of blood vessels. JGA of kidney, juxtaglomerular apparatus of the kidney. So the juxtaglomerular apparatus of kidney, you can notice here. Okay, juxtaglomerular apparatus of kidney. So what they are going to do is they produce erythropoietin, a peptide hormone. It stimulates erythropoiesis, formation of RBC. Okay, so the formation of RBC was also one of the roles of aldosterone. Okay, so now the erythropoietin is secreted by juxtaglomerular apparatus of kidney. So they are going to secrete a hormone called as peptide hormone, that is erythropoietin. It stimulates erythropoiesis, that is formation of RBC. Erythropoiesis is formation of RBC that is stimulated by erythropoietin, and that erythropoietin is being secreted by the juxtaglomerular apparatus of kidney. The gastrointestinal tract, so you can also remember it as GIT, okay, or GT. The gastrointestinal tract, they are going to secrete peptide hormones like gastrin, secretin, GIP, that is gastrin inhibitory peptide, GIP, CCK, cholecystokinin. So these are some of the peptide hormones produced by the gastrointestinal tract. So what is the role of gastrin? As the name indicates, gastric juice, it stimulates gastric glands to secrete HCl and pepsinogen. So gastrin stimulates the gastric glands to secrete HCl and pepsinogen. So secretin, it stimulates exocrine pancreas. So the exocrine pancreas, that is the duct gland, okay, which secretes enzymes. So that part of the pancreas so is stimulated by secretin, and they secrete water and bicarbonate ions. So the secretin stimulates the uh, exocrine part of pancreas to secrete water and bicarbonate ions. Then GIP, gastric inhibitory peptide hormone. So this inhibits gastric inhibitory peptide. This inhibits gastric secretion. Cholecystokinin, CCK, it stimulates the secretion of bile from gallbladder and pancreatic enzymes from pancreas. So cholecystokinin hormone is going to stimulate the secretion of bile from gallbladder and pancreatic enzymes from pancreas. Okay, so that is the role of this gastrointestinal tract, hormones secreted by gastrointestinal tract. So the several other non-endocrine tissues, they secrete hormones called as growth factors. Okay, several non-endocrine tissues also secrete hormones called as growth factors. So these are the uh, essentials for the normal growth of tissues and repairing or regeneration. Okay. So we'll discuss about the types of hormones based on chemical nature in the next class. So have you understood about all the concepts as of now, dear students? Any doubts or clarification? Any doubts or clarification, dear students?